is an issue that's not a blue versus red. This is about all of us.
Yes, all of us. Yeah.
So I also would like to say, look around you. We are, we're a relatively small group, but we're part of something really large that's going on right this moment across the nation, in cities and towns, everywhere.
We the people.
Yeah, we the people. All right. Okay, so
this is Mark Pierce, a retired
I'm not a
emergency
public speaker by any stretch.
physician.
I just wanted to touch on just a couple of things. First of all, NIH. They've cut funding dramatically. They've cut funding dramatically for it. They've lost at least 1,500 employees, and again, the funding is going down such that it will threaten labs and even hospitals.
It's our NIH.
Across the yes, it already is.
Musk NIH.
And then, you might have heard of it. NIH. They do biomedical research. They do vaccine research, cancer treatments, surgeries, medications, nutritional insights, etc. So, it's one of those things that's kind of important, for all of us.
Yeah.
And then you have the Health and Human Resources. It is now overseen by Kennedy Jr. What else can you say? So they have lost, nearly all of their probation folks. It's like 5,200 workers that are in their probationary period, including 1,300 that work at the CDC. You might have heard of the CDC as well. Things like epidemiology and virology and infectious diseases that are kind of important to all of us. Measles is already going up. TB is going up. The bird flu is out there, and because there's a gag order on the CDC, we don't really know what the status is with the bird flu. They also are in charge of social services, prevention and wellness, public health and safety, emergency preparedness and response, and again, vaccine. I know. So, then of course there's cuts to Medicare and Medicaid, which are pretty much self-explanatory. And one issue there, which we really need to be cognizant of, is that cuts in Medicare and Medicaid, they pose a very significant risk to the existence of Shenandoah Memorial Hospital. They can't go, they can't just give it away. They got to have some kind of an income. It's hard for me to, how does any of this